Hey everyone, and welcome. Today we're diving into some absolutely fascinating new research. It's like we're unlocking a hidden language inside our own bodies, a language that could totally change the game for protecting our kidneys. So, let's jump right in and see what the science has found. Just think about this for a second. What if we could know with real precision who's at high risk for serious kidney damage long before that damage becomes permanent? That's the huge question at the very heart of what we're talking about today.
Okay, so to really appreciate this breakthrough, we first have to get a handle on the problem they're trying to solve. And believe me, it's a big one, a silent threat that affects millions of people.
We're talking about something called diabetic nephropathy, or DN for short. Basically, it's a slow burn disease where diabetes just gradually wrecks the kidneys over time. And this is no small issue. It is the single leading cause of people needing dialysis or a kidney transplant across the entire globe.
So just how common is it? Well, check this out. A whopping 40% of all people with type 2 diabetes will end up developing this complication. That's almost half, facing a very real risk of their kidneys failing for good.
And this right here, this is the real dilemma doctors are up against. You see, our current tests are pretty good, but they usually only find the damage after it's already happening. It's kind of like having a smoke alarm that only goes off once the room's already filled with smoke. What we desperately need is a way to detect the problem way earlier, to smell the smoke before a fire even starts.
And this is where the science gets really cool. To find those super early warning signs, researchers started looking in a pretty clever place, our urine.
So, think about it like this. All the cells in your body are constantly talking to each other. They're sending out these tiny little packages, almost like a cellular mail service, giving each other status updates and instructions.
Now, the official scientific name for these little packages is extracellular vesicles, or ECVs. They're basically these little bubbles that cells release, and they're stuffed with important cargo, especially different types of RNA, which act like tiny instruction manuals for other cells.
And here's the truly brilliant part. Your kidney cells release these packages directly into your urine. And inside those packages are these tiny instructional notes called microRNAs. So the big idea is, what if we could just intercept this mail from a simple urine sample, read the notes, and get a direct, real-time report on exactly what's happening inside the kidneys?
Okay, so that's a great idea in theory, right? But how do you actually go about testing it? Well, it all came down to a really smart experimental design.
The researchers were incredibly clever here. They collected urine from three very distinct groups: healthy people, people with diabetes whose kidneys were still fine, and people with diabetes who had already developed kidney disease. This setup is just perfect because it lets you compare the cellular mail from all three and find the exact messages that change when the kidneys start getting into trouble.
And when they finally decoded all those messages, they found something pretty remarkable. Not just random noise, but a very clear, very specific signature.
So out of thousands of different signals they were looking at, 2 specific microRNAs just popped. Their levels didn't just go up or down, they did something really unique. They acted like a biological switch that gets flipped the moment the disease really starts to take hold.
And this illustrates the pattern perfectly. Take a look at the first one, MIR 151A-3P. In people with diabetes but healthy kidneys, its levels actually went down. But, and this is the kicker, in those who had kidney disease, its levels shot way up. It's a total reversal, a clear switch.
And what's just amazing is that they found a second one, MIR 182-5P, that did the exact same thing. Down first, then bam, sharply up. Now, in science, seeing a pattern repeat like this is a huge deal. It tells you this isn't just a fluke, it's a real biological signal that's tied directly to the disease.
But, what do these instructions actually do? Why are these 2 tiny molecules so important? What are they telling our cells?
Well, it turns out these little guys are more than just passive warning flags. Not at all. They are active commanders inside the cell. Their whole job is to control the on and off switches for a whole network of really important driver genes that are absolutely critical for keeping your kidneys healthy.
The researchers were able to identify a bunch of these major driver genes, but 2 in particular, PTEN and VEGFA, are super important. You can think of PTN as a key manager for how cells respond to insulin, and VEGFA is like the head construction foreman for all the delicate blood vessels inside the kidney. Since our kidneys are basically just these incredibly sophisticated filters, they need both a perfect energy supply and pristine plumbing to work right. And in diabetic kidney disease, both of those jobs start to go haywire.
And this, right here, is the real payoff. As the researchers themselves put it in their paper, finding these microRNAs doesn't just give us a potential early warning sign. It actually points to a promising new way to treat the disease. If we can figure out how to control these microRNAs, maybe we can regulate genes like PTEN and actively protect the kidney.
So let's bring it all home. What could all this mean for the future of kidney care for actual patients?
Now, this isn't about replacing what doctors already do. It's about adding a powerful new layer of information. This research is basically a blueprint for a future test that could work alongside current methods to give a much, much deeper molecular picture of what's really happening inside a person's kidneys.
The potential impact here is huge, and you can really break it down into three things. First, a real early warning system. Second, the ability to create personalized medicine based on a patient's unique RNA signature. And third, it gives drug developers brand new targets to aim for when creating therapies that could maybe slow or even stop this awful disease in its tracks.
And that leaves us with a really fascinating final thought. We just saw how decoding these tiny messages could revolutionize care for one specific disease. But what if this is just the tip of the iceberg? Could reading these unique RNA signatures from all of our cells one day become the ultimate tool for a future of truly personalized preventative medicine? It's a pretty exciting future to think about.